But
Yes,
I've got
do.
an electric toothbrush.
Okay, well, whatever you use.
I just started using it. I like the old-fashioned way.
Well, whatever you use, can you give me a close-up there, please? Whatever you use, you want to place your device or brush at a 45-degree angle, and that way you can put the bristles up between the tooth and the gum. There's a natural space there called the sulcus.
Okay.
And if you maintain that 45-degree angle while you're brushing, that will remove the plaque that causes gum disease and tooth decay.
That's what electric brush does too.
Well, some
because
of them.
If you, some.
Not all of them. Not all of them are equal.
I'm so impatient to get my teeth clean. I'm moving the brush around even though it's automatic. I'm doing both things at the same time. And these are the implants you were saying before?
Yeah, these are implants, and this shows how we can make a bridge with an implant. As you said earlier, the implant is placed, and then 3 to 6 months later, after the bone has integrated with the implant, we put an abutment on top of the implant.
Like a screw.
Yeah, the implant is a screw, and this is a platform that the crown is going to go on.
Okay.
So there are 3 separate parts to an implant. The implant, the abutment, and then the crown fits on here. This is a permanent bridge that doesn't come out. Some people may not have the money for a fixed bridge. So what we can do is make your denture, especially at the lower when they're loose, we can place implants, and the implants will engage the inside of the denture, and that way you don't have a lower denture that's going to move around on you, because they're very hard to stay in place at the bottom when you don't have sufficient bone.
And you have to be very careful what you eat.
Yes.
We talked about that for a while ago.
Yes, yeah. And that's, you can't chew hard things.
You can't bite down on a, what do you want to call it, olive and get the pit in your mouth. Chew popcorn.
Right.
Eat those sticky, chewy candies like I like, because
They are
that's
the worst. The sticky, chewy candies.
like the juji fruits. They're all different colors.
Okay. They're not good for your teeth.
They're not good for your teeth. Okay.
Right.
What about mouthwashes?
Doesn't matter a lot, the mouthwashes.
It doesn't matter?
No, what really matters is how well you brush. Toothpaste freshens your mouth.
And it tastes good.
And it tastes good. And we have fresh breath and we interact with other people.
Right.
But the main thing that works is the mechanical action of brushing. That removes the plaque that contains a lot of the bacteria.
We're going to take a second and we're going to show the video that you wanted us to show on teeth, okay?
Okay.
An implant is an excellent way to replace a missing tooth and keep a good-looking smile. A dental implant is a small titanium cylinder that's surgically inserted into the bone of the jaw to replace the root of a missing tooth. An artificial tooth is attached to the implant. Placing a dental implant after a tooth's been lost can prevent a chain reaction of problems that would affect your entire mouth. Teeth need each other for support. When a tooth is lost, the biting forces change on the teeth next to the space, and they shift. When a tooth no longer has anything to chew against, it begins to extrude out of the socket. You can eventually end up losing it too. When your bite is slightly off, it's common that one tooth may hit sooner than the rest. This causes undue stress on the involved teeth, and they begin to flex. It is this continual flexing and stress over time that causes the enamel to separate from the inner dentin layer, forming the familiar-looking notch that we call abfraction. As your bite changes, it gets harder and harder to chew your food, and you may get damage to your jaw joint, the TMJ. It's much harder to clean teeth that have shifted. Harmful plaque and tartar collect in these new hard-to-reach places, causing cavities and the permanent bone loss that comes with gum disease. A bridge is another way to solve the problem of a missing tooth. But 2 advantages of an implant over a bridge are that the teeth next to the space aren't affected, as they are in this bridge prep, and the implant helps stop the ongoing bone loss that occurs once a tooth has been lost. A missing tooth really changes a person's smile, but a dental implant can replace the missing tooth and improve your smile.
I enjoyed your video very much.
Thank you, thank you.
How long did it take you to get that together?
Not very long.
Those pictures were really well.
Yeah, not very long, but we enjoyed it. My staff is great.
I met 2 of your staff who are sitting right here with us today. They should stick their faces over here in a minute. But you have a great crew that you work with.
Thank you.
It's like a family.
Yes, it is.
And I bet nobody walks around and moans and groans and complains, do they?
No, they don't. No.
All right, I want to go back to gums. For some reason, I'm very into gums today, all right?
Okay.
I think that we need to have something, some good advice from you on the kind of toothbrush, soft or hard or medium, okay? And the exact way like you showed with this biggie one here about brushing teeth. And I want people to know that there is a way for you to help them. You or whoever, you know,
Right.
if they're having that problem with their mouth.
Okay. The biggest problem with gums is the accumulation of plaque. Plaque forms on our teeth every day, and it has nothing to do with whether you eat or not. Okay. The plaque contains a lot of bacteria.
That's what I wanted to know. The bacteria grows.
Yeah, it grows, and if you don't remove it every day, it keeps growing. And then when you get a certain amount, it causes your gums to swell, and that's when you get gingivitis.
And they get all red too, don't they?
Red and puffy. Yes, they do. And this is a reversible condition, so if people just go in every 3 to 6 months to see their dentist.
How about every 4 months for a cleaning? What do you think?
I like 3 to 6. It depends on the person.
3 to 6.
I tried it. Well, 4 is not bad. You see 3, 4, same thing, because you can tailor it to the individual. Because some people do a better job of cleaning their teeth, and they may be able to go 6 months. Some people, they don't do as good a job. They may have to come in every 4 months.
What about children, young children? I have a great niece who's going to be 7 next week. I love her dearly. I had her brushing her teeth at 1 year old.
And you should.
She watched me, and I got her a little stool, and she got up on it, and as I would brush my teeth, at 1, she knew what she was doing.
Yeah, and you should help her. So a good thing about that is like you let them do it, and the agreement is you're going to do it as well. And you limit the amount of toothpaste that they're going to have.
Oh, yes.
Okay, you don't want swallowing all that toothpaste.
They take all that, yeah.
Yeah, so you watch them. So they brush and you brush, and that's a great time to start them. You're developing a great patient.
She had 2 little teeth in the front. And I told her if she didn't take care of them, she's going to lose them like grandmother.
Oh, gosh, okay. All right, well, that probably
Do you
works.
remember that Christmas song, All I Want for Christmas is My 2 front teeth?
Yes, I do.
I didn't get to hear it this year. All right, let's get back to dentistry.
Okay.
All right, we can't talk about fees because that's I can't do that.
Right.
But do you charge for office visits?
Yes, we
I don't want
do.
to put you in a bad place.
No, we do charge for office visits, but we actually don't charge for consultations for implants.
Okay.
We run specials where we will see you for no charge to give you a consultation on an implant or implants. Because we do like to service the community, and we do want to give something back. And even if you get charged for certain things, a lot of things I do, we don't charge for.
Oh, that's wonderful.
Yeah, I don't tell people. I'm trying to get better at telling people, but I like to give something back to the community that has given so much to me.
That's good.
Yeah.
That's good. What about a very nervous patient?
Nervous patients.
I can get very hyper.
Yeah. Well.
How would you calm me down?
Well, the first thing we try to do is we try to make you feel very warm and welcomed into our office. So my staff greets you, smiles, let you know that you're a person first. You're not a patient walking through the door, okay? And we try to explain everything that's going to be done before it's done, so you kind of get an idea in your mind what's about to happen. And then when you get in the chair, before anything is done, we tell you, if you need us to stop for anything, just raise your arm so that you're in control. Now, if we have people that doesn't work for, then they may need some other type. They may need sedation or oral sedation or IV sedation.
Just for a routine checkup, I mean, to come in, say they've got bleeding gums or something like that, and they come in, you find a problem, okay?
Yeah.
And then when they come back, I can see coming back for dental implants, they give you shots, though. You have sedation in the arm, huh?
Yeah. We're going to be doing that later this summer.
Yeah.
For the IV sedation, but most people we manage without it. But for those who need it, you can take a pill that will relax you. And
That good old diazepam?
Yeah, well, you know about that.
When you fall down and break your hip, you know a lot of things.
Okay.
But diazepam is good. It's not, I guess any drug can be for me. But
Yeah.
I don't, I had to have something.
Yeah.
Okay. What is your most patient, women or men?
Women by far.
Because we like our looks.
You like your women like their looks, and they're more into health.
Yes.
The woman comes in, she paves the way. The kids come in after that, and then finally it's a tug of war to get the guys in.
To get the guys in there with you.
But women are far better patients and much more in tune with their bodies and to health.
Okay, I act on an impulse sometimes. Do you ever have any patients who come in to you and say, yeah, I like the implants, give me 5, give me 6, whatever I need, and then change their mind and call you up and say, I don't want that?
Of course. And that's okay.
That's okay?
Yeah, that's okay.
Okay.
And we explain to people sometimes, it's okay, you change your mind, why don't you just come in, have routine services done, cleaning, exam, and just get to know us better.